Okay, it's recording.
Today our presentation is on non-small cell lung cancer. My name is Maggie Camp.
I'm Kelly Chambers.
Spencer Hudson.
And I'm Gabrielle Ryan.
This first slide gives a background on a non-small cell lung cancer. So lung cancer is extremely deadly, making up about 25% of all cancer mortalities. Non-small cell lung cancer makes up about 85% of lung cancers, while small cell lung cancer makes up the rest. Focusing on non-small cell lung cancer, here are three subtypes: adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. All of these originate in the epithelial tissue of the lungs. On the next slide, epithelial cells of the lung can be found lining the outside of the organ and the inside cavities. Their function is to protect the lungs by acting as a barrier and to moisten the airways for breathing. Adenocarcinoma makes up about 40% of all lung cancers and tends to start growing in the alveoli. Alveoli are sac-like structures that aid in the function of diffusion across the capillaries, and they are located on the bronchioles, the alveolar duct walls, and the alveolar sacs. Squamous cell carcinoma makes up about 20% of all lung cancers and tends to start growing in the squamous cells that line the bronchi of the center of the chest. Bronchi are the airways that start at the trachea and extend into the lobes of the lung, which aid in easier breathing. Finally, large cell carcinoma makes up about 3% of all lung cancers and tends to form in the outer edges of the lung tissue.
The most commonly mutated tumor suppressor gene seen in non-small cell lung cancer is the p53 gene. In 70% of cases, this is a somatic mutation, meaning that is not inherited mutation normally. In a normal cell, the function of the p53 gene is to act as the guardian of the genome. It is responsible for regulating division of cells with abnormal DNA by stopping them at the GS1 or the G1S checkpoint. P53 is held by the protein MDM2. When MDM2 detects abnormal or mutated DNA at this checkpoint, it will release P53, which will then cause the abnormal cell to arrest and not pass further into the cell cycle, including the replication of the abnormal DNA. If the cell is able to repair the abnormal DNA, P53 will allow it to re-enter the cell cycle. If the cell is too damaged, it will either remain dormant or die in a process called apoptosis. Because the G1S checkpoint is dependent on P53, a loss of this function will result in invasion of cell death and genome instability, two hallmarks of cancer. Next, we'll talk about the EGFR proto-oncogene. In normal cells, the epithelial growth factor receptor is found on the cell membrane with an intracellular tyrosine kinase domain. This receptor enables the regulation of epithelial cell growth and homeostasis. The lung alveoli are covered in such cells and are also found in 95% of the peripheral lung surface, making them abundant in lung tissue. Phosphorylation of the tyrosine kinase domain starts the signal transduction process within the cell, leading to proliferation, differentiation, and migration. If this domain becomes autophosphorylated, control of cell division is lost. Next.
So this section is the lung cancer epidemiology, and we will be talking about the incidence rate. In both men and women, lung cancer is the second most common cancer that is diagnosed within America. For the males, the rate of new lung cancer cases had the highest incident rates in Kentucky, Mississippi, and Arkansas. In Kentucky had 93.2%, and Mississippi had 91.2%, and Arkansas had 90.6%. The lowest incident rate based on race were from American Indian and Alaska Native males with only 650, and the highest incident rate were white males with 93,000. In 2018, there were roughly 111,000 new lung cancer cases reported. The rate of new lung cancer cases within females was similar as the males. The states with the highest incident rate was Kentucky, West Virginia, and Maine. The highest incident rate based on race were white females. The lowest incident race was also American Indian and Alaskan Native. And in 2018, there was about 100,000 new lung cancer cases reported. For the mortality rate in 2018, roughly about 76,000 males died of lung cancer, and for every 100,000 men, 40 died of lung cancer. And the states with the highest mortality rate included Mississippi, Maine, and Kentucky. And for women or females in 2018, roughly 65,000 females died of lung cancer, and for every 100,000 women, 29 died of lung cancer, and the states with the highest mortality rates included Kentucky, West Virginia, and Maine. Now for the observational intervention studies, the first observational study was titled Urban Air Pollution and Lung Cancer in Stockholm. The objective was to explore the possible associations between lung cancer and the urban air. And for the methods, it was a population-based case control study that used 40-year-old to 75-year-old men. And the data was collected via postal questionnaires, and it talked about risk factors that all the males were exposed to. And the emission database for NO2 and SO2, which is nitrogen dioxide and sulfur dioxide, was created as air pollution indicators. Researchers estimated the local source of specific air pollutions based on the participant's address. And as a result, there was an association between road traffic, NO2 exposure, and lung cancer development. For the intervention study, it was titled Symptom Improvement in Lung Cancer Patients Treated with Tarceva. The objective was to discuss the quality of life findings of a randomized placebo-controlled study, and the methods were used was a double-blind phase 3 trial randomly assigned to 731 patients with non-small lung cancer. And as a result, patients that were on this drug lived longer compared to patients on placebo, and they actually saw significant symptom alleviation compared to patients on placebo. In conclusion, the Tarceva improved survival and tumor-related symptoms, and some common side effects for individuals that are on Tarceva include diarrhea, dry skin, mouth sores, and eye irritation.
Okay, for this part, we're going to go over some clinical cancer research. In lung cancer screening, lung cancer is the most deadly cancer in the United States. Screening with low-dose computed tomography can reduce the risk of getting lung cancer by finding early-stage cancer. Unlike screening with chest x-rays or sputum cytology, which do not reduce risk of dying. And some stages of lung cancer. Early signs of lung cancer can include a cough that persists or gets worse, cough that produces blood, back or chest pain that can worsen during coughing or deep breathing. People diagnosed with stage 1 cancer can expect to live 5 years or longer. 5-year survival rate for stage 2 cancer is about 60%. And for stage 3 lung cancer, survival past 5 years is about 20%. About 16% of all new cancers in the United States is lung cancer. There are some different ways that people go about treating lung cancer. Surgery, which is the removal of a tumor. Radiation therapy is using x-rays or other forms of radiation. Chemotherapy is killing or stopping growth of cancer cells with a drug. Targeted therapy can be combined with other therapies. Immunotherapy. There's laser therapy, photodynamic therapy, cryosurgery, and electrocautery. Next, please. Some more symptoms would be persistent cough, shortness of breath, chest pain, wheezing, respiratory infection, fatigue, weight loss, and a reduction in appetite. Patients with lung cancer can also have some emotional side effects that can include feelings of being overwhelmed, denial, anger, fear, stress, sadness, guilt, loneliness, but also some positive things, maybe like gratitude and hope. Therapies like radiation and chemotherapy can have very harsh side effects, such as tiredness, hair loss, and nausea that can be extremely rough on patients. Factors that can affect what lung cancer patient's outlook will look like are age, sex, and a person's ability to be to take care of themselves. Tarceva is coupled with chemotherapy in some cases. Patients who received Tarceva had a median survival of 22.9 months.
The way Tarceva targets these cells specifically, it is a tyrosine kinase inhibitor, which directly affects the uptake of epithelial growth factor. When epithelial growth factor becomes an oncogene, it is involved with the uncontrolled cell growth and proliferation within the mutation. So instead of having the growth factor bind with the tyrosine kinase domain, it replaces it, which inhibits the cascade. It specifically reacts by bonding to the epithelial growth factor receptors that have either a deletion mutation in exon 19 or a substitution mutation in exon 21. By specifically targeting these cells, it makes it it makes it a specific target. Next slide, please. So non-small cell lung cancer is the majority of lung cancers, specifically the bronchoalveolar adenocarcinoma. Tarceva is most effective in women, those of Asian descent, and people who are never smokers that get lung cancer. It can be a first-line treatment, meaning the first treatment a patient receives a maintenance therapy, or it can be a second or third line treatment if tumor progression is seen with prior treatment. Next slide, please.
Some more side effects of the drug Tarceva could be bleeding, clotting, eye disorders, skin conditions, stomach, liver, and lung problems. Also, alteration of scalp hair. It's not always hair loss. Weight gain can occur. What's that?
I can get this part if you're good.
Oh, okay.
The most commonly seen grade 3 or 4 adverse reactions are diarrhea and rashes or skin irritation. This is because of the off-target effect. There are other epithelial cells found in the body, skin cells that are found on the surface of the skin and lining the GI tract. making, in some cases, having Tarceva target those cells as well, making the adverse reactions worse. That's all I got. Dosage, Tarceva is commonly prescribed 150 milligrams daily, is best given on an empty stomach and 1 to 2 hours before eating for best bioavailability. The therapeutic index is 50 to 150 milligrams daily. There is 60% available at intake, and peak plasma levels occur 4 hours after intake. As I mentioned before, GI upset is a common adverse reaction. And because concentration decreases as pH increases, a lot of the antacid medications are discouraged, even though they would help the patient. Next. That's it.
Please enjoy this list of citations.